We know that financial crises can affect the current level of income and consumption among poor households in the developing world. What's important to note, though, is there are often much more long-lasting consequences of such shocks. These shocks can affect the very likelihood of survival for children in the household. It can affect the quality of their nutrition, which we know has much more long-lasting consequences throughout their lives as these children grow up. And it can affect the educational attainment of such children, often for the worse.
Many studies have shown that how children fare during economic crises has to do with how rich or poor their country is. In general, crises often lead to better child health and education in rich countries because unemployed parents may spend more time with their children and cut spending on products such as alcohol. The picture is mixed in many middle-income countries, where children's health may decline, but school enrollment may go up. But the story is grim in low-income countries, because economic downturns seem to be hitting the children there the hardest. The current financial crisis, for example, has claimed the lives of as many as 50,000 infants in sub-Saharan Africa, almost all of them girls, according to recent research by the World Bank's Development Research Group.
Well, the first thing to note is Africa is a continent where 3 million infants die in any given year. However, the work we've done at the World Bank Research Group estimates that as a result of the current global financial crisis, an additional 30 to 60,000 infants will die in Africa before their first birthday. What's very important to note is we believe the vast majority of these excess deaths will happen to girls. This is a surprising finding because Africa is not known as a region that prefers sons over daughters.
Infants die during economic crises because families facing an income shortfall tend to spend less on food, especially healthy food. They are also more likely to skip doctor's visits when their children are sick. In addition, the public health systems in some countries may break down, making it harder for patients to get care. While countries may eventually recover from economic crises, the impact on children's physical and mental health could last a lifetime. Some researchers say policymakers should address children's needs during and after economic crises by, for example, ensuring the quality of health care and food security for poorer households, especially girls.
I think we can consider policies targeted directly towards the health of girl infants. For example, a conditional cash payment to assure the health of girls at their first birthday or even at earlier ages might have benefit at times of crisis.